This video continues Chapter 26 of OEC6. We've been talking about environmental injuries and specifically in Chapter 26, heat-related emergencies. Here we want to focus on the assessment of these four types of heat-related illnesses. So a couple of things that we'll encounter will just be around some of these terms, especially thermoregulation. When we talk about patient assessment, just for any heat emergency, things don't change. In our primary assessment, address any threats to life after we've made sure to protect ourselves as part of our scene size up, and if possible, move the patient to a safer area. So the first thing to consider is heat syncope, or essentially heat fainting. Now, they're going to be slightly tachycardic. They're going to have hypotension initially. And because they've fainted, just consider the possibility of traumatic injuries that may have occurred. In your primary assessment, consider the A's and B's. And then if there is no pulse or breathing, when you check C, follow your current CPR guidelines. If the patient has a pulse and is breathing, you can maintain the airway and proceed with your secondary assessment. For heat syncope, they're rapidly going to regain responsiveness, and we can help restore some of their thermoregulation, make sure that they're hydrated, make sure that we minimize their exposure to the environment. For heat cramps, well, the classic signs and symptoms are going to be these intense, painful muscle spasms. It may also be accompanied by some abdominal cramping, but they'll resolve after a minute or two, so our treatment is essentially symptomatic. Heat exhaustion is that more severe condition, and there's lots of signs and symptoms. We'll see some faintness and lightheadedness. We'll have some weakness accompanied by normal or slightly elevated body temperature, and this is a key. A lot of times the sweating is going to just be very profuse. When that patient progresses to heat stroke, this is that life-threatening emergency. They have just overcome their body's ability to regulate with the heat. The sweating mechanism traditionally has been exhausted, and so consequently they're going to have red and hot, dry skin as a result. In addition to some of those other pieces of heat exhaustion, this can be one of the differentiations that we occur, but most importantly, they're going to have altered mental status. Remember, heat stroke is a life-threatening emergency. We need to respond pretty quickly.